Hello everyone, welcome back to my YouTube channel or welcome to my YouTube channel. My name is Maria and we are talking about lichen sclerosis. All this time we've been talking mostly about lichen sclerosis in women, but unfortunately, as we all know, this disease can occur in any sex. So let's talk today about lichen sclerosis in men. As in case with women, lichen sclerosis in men is mostly a genital disease. It is located on the foreskin and the tip of penis. It can affect men and boys at any age. In some cases, lichen sclerosis starts to affect skin elsewhere on the body. So for example, it can be arms, legs, hands, and even ears. It can start with itching or peeling skin. It can cause white patches. Usually lichen sclerosis on anywhere on your body doesn't give you that much trouble as it gives you on genital area. Symptoms of lichen sclerosis in men can include itching, burning, soreness. Then, as it develops, it can cause blistering, bleeding, splittings, fissuring, tearings, dysuria, adhesions, and scarring, which is pretty much similar to labia fusion, tightness of the foreskin and painful erections, dribbling, spraying, UTIs, and even something like thrush. The affected skin feels uncomfortable, itchy, burning, sore, especially during sex and after sex. Often, lichen sclerosis leads to foreskin tightening and it becomes more difficult to retract, which is the cause of painful erections. During the sexual intercourse, lichen sclerosis affected skin can even tear and bleed. If the skin on your penis looks red, has some tearings, ulcers, little cracks, if it's sore, or if you're experiencing some itching, burning that is constant, that doesn't go away, you have to immediately see the doctor. The problem with men is that they don't have gynecologists and specialized doctors who can easily say that yes, you have lichen sclerosis. So you have to go to a dermatologist and basically ask for a biopsy. Biopsy is when a small part of your skin is cut off and sent to the laboratory. This is the most reliable option to know what is wrong with you. But be aware that some men, however, don't experience any symptoms, at least for the most of their life. Let me tell you how the white patches appear. When skin is inflamed and red and sore for a long period of time, it can become thin, which means you can have skin atrophy. However, there are a lot of cases where skin started to become thicker. The scarring appears, the buildup of collagen leads to it. As you know, there are two types of damage that lichen sclerosis causes, and in men it's the same as in women: skin thinning or skin thickening. When scarring develops, it changes the appearance of the penis. Sometimes the foreskin gets so tight around the penis that it makes impossible to clean the tip of it. There are some men who had the circumcision and lichen sclerosis went away, at least for some long period of time. But don't think that it's a cure, because there are some cases when after the surgery the disease proceeded to develop. You have to understand that lichen sclerosis is an autoimmune disease and it doesn't go away by itself. If you delay the right treatment, lichen sclerosis can develop, and all of the above can happen, and then to fix something will be very, very hard. What can you do? Doctors give some advices, like after you urinate, every time you have to carefully dry yourself to avoid the contact of urine and the affected skin. Also, using a moisturizer or even a Vaseline can protect the skin, restore its natural barrier. You have to keep your pubic hair trimmed so they do not get trapped between the foreskin and penis. Using a lubricant during sex will help you to reduce the excessive friction. And of course, if you're a smoker, please consider quitting to avoid the risk of getting cancer. Very important is self-examination, because when you know what is happening with your organism, what is changing, you can easily understand, are you close to remission, or maybe you're close to changing your medication, or maybe you have to go and see another doctor. Also, some of my nice male subscribers shared their tips of taking lichen sclerosis under control. Among those tips were vegetarian diet or keto diet, olive oil, herbal teas, moisturizers, meditation, burning, etc. And I want to finish this video by saying that there are a lot of groups of support for women, and they actually discuss what an emotional burden lichen sclerosus is. They ask their partners to understand how hard is it for them to not have a normal sexual life, to live with this, to have this burning sensation all the time. I just want you to understand that men with lichen sclerosus are experiencing the same emotional pain, the same emotional burden, the same burning, soaring sensation with which they wake up every day and with which they go to bed every day. If you are in a relationship with a man who has lichen sclerosus, just please try to understand him. Try to realize how much this problem affects him, his mental health, his physical health, his life in general. You can be a good emotional support, and if you want to know how to do this, I will link down below in the description of the video some tips of how to mentally help a lichen sclerosus patient. That's it for today. Thank you all so much for watching. I hope you got some useful information from this video. Please subscribe and hit the bell button. Bye bye!